one of us who are doing our part to follow early and aggressive social distancing measures I put in place, Oregon is in a position where I can lift the executive order delaying non-urgent procedures for our hospitals, clinics, surgery centers, and dental offices. The order will be lifted as of May 1st. Healthcare providers must demonstrate that they meet the criteria for COVID-19 and preparedness. Once they do, they are eligible to restart non-urgent procedures. Many Oregonians have been hoping for this news because it means we can now start to think about scheduling that much-needed dental work or medical treatment that you've been waiting for. I personally can say that I am very excited to schedule a dental cleaning appointment very, very soon. But I have also heard from many Oregonians who have felt the physical and emotional pain of putting their health care on hold, from a delayed knee surgery to a fertility treatment. I'm really grateful to allow these important procedures to resume. I know that halting these types of procedures has been an added strain to Oregon's rural hospitals and healthcare providers during this crisis. This order allows them to get back to providing much-needed care for Oregonians across the state. Today's good news is a signal that Oregon is on the right path in fighting this virus. It's just a small step, and one that, like many others, we need to take with caution. As hospitals, clinics, and dental offices begin non-urgent procedures bring them back online, we have to remain vigilant in how we're going to do it. I think, as many of you know, I grew up in Minnesota, and in the winter, our ponds and lakes would freeze over. I love to ice skate on our ponds. When you try and walk on the ice, you'd take a small step, put your weight on it, and then take a pause. If everything was okay, then you'd take one more step, put your weight on the ice, and pause again. This is similar to how we're approaching reopening in Oregon. We're only stepping onto the ice carefully and cautiously, one step at a time. If we see a crack in the ice or find ourselves in a precarious position, then we may need to pause for a bit longer. Sometimes we may even need to take steps back toward more solid ground. By lifting this order, we're giving our hospitals, our clinics, and medical offices the green light to move forward with non-urgent procedures. But let me be very, very clear. We still need to proceed with this step very carefully. We will continue to monitor how this will affect our hospital systems and our healthcare workers in line with how the virus is moving through our state. Lifting this executive order will also have a real impact on many of our hospitals and clinics, especially in rural Oregon, where these procedures play an important role in the financial stability of our healthcare system and our workforce. It will also have a real impact on the quality of life for many Oregonians who have patiently waited to schedule these important procedures. Thank you again to each and every one of you, every Oregonian who has followed the Stay Home to Save Lives order. Thank you to every single dental and veterinary office that donated your PPE to our hospitals at the outset of this crisis. We were able to lift this executive order because of our collective efforts to protect each other, and I'm very grateful for that. With that, I'm going to kick it over to Dr. Dana Harganani to share additional details of the guidance. Thank you.
Thank you, Governor. We have been watching our case counts and COVID-19 hospitalizations closely. And as our modeling indicates, it appears that our aggressive physical distancing measures combined with increased hand hygiene have dramatically reduced the burden of COVID-19 in Oregon. COVID-19 hospitalizations have been flat or slightly declining overall, and we expect that adult acute care and intensive care unit beds across hospital will remain below will remain at the capacity we need them to be in the foreseeable future. One of the aggressive measures taken in the last 6 weeks, as we just heard, to cancel all elective and non-urgent procedures was appropriate to ensure we had enough hospital capacity and personal protective equipment in preparation for a potential surge of COVID-19 cases. But prolonged cancellations of those procedures also come at a cost to Oregonians. While not emergent, these cancellations included procedures that are necessary and, if further delayed, could impact Oregonians' health. These include procedures that may improve pain, such as a hip replacement, reduce the burden of symptoms like a sinus surgery, or relieve the fear of potential cancer, such as possible with biopsy. These kinds of deferred procedures add to the suffering COVID-19 has imposed on Oregonians, while indirect, the toll has been real. We also recognize that cancellation of elective procedures has undercut the financial stability of the healthcare system we depend on as our frontline defense against the virus. It is now appropriate that we begin to let these procedures move forward, but slowly, safely, and with caution. As we begin to resume non-emergent and elective procedures in Oregon, we must keep the following priorities at the forefront. First, to minimize transmission of the virus to patients, healthcare workers, and others, to avoid further delays in needed healthcare for Oregonians, to maintain adequate hospital bed capacity in case of an increase in COVID-19 cases, to minimize transfers to skilled nursing facilities and other long-term care facilities due to the vulnerability of these congregate care settings, and finally, to reduce the financial impacts to Oregon's health system. In order to proceed, we are requiring hospitals, ambulatory surgery centers, and office settings to have adequate PPE supplies on hand so that they can sustain recommended PPE use for its healthcare workforce. In addition, healthcare facilities must start slowly. For hospitals and ambulatory surgical centers, they must be sure to maintain hospital bed capacity at or above 20% in order to accommodate the potential for increased COVID hospitalizations ahead. In addition, they must start at a maximum of 50% pre-COVID procedure volume, reassess biweekly, and maintain PPE supplies and capacity before expanding. For medical and dental offices, procedure volume must be minimized to ensure social distancing and PPE supplies can be maintained. In all cases, we ask that these facilities review and prioritize procedures based on the indication and urgency as we ramp up slowly, and to consider postponement of procedures that are expected to require critical resources. And finally, all facilities must maintain a plan to reduce or stop non-emergent and elective procedures should a surge or resurgence of COVID-19 cases occur in their region, and the state will continue to monitor and adapt these criteria as needed. The sacrifices Oregonians have made by following Governor Brown's executive orders have made a difference. By staying home, Oregonians have saved lives. This is one small step towards reopening in our state, and it's only possible because of all of the work we've done together to contain COVID-19. The framework we are putting into place is a balanced and safe way to get our healthcare workforce back to work and address the important healthcare needs while being prepared to slow down as needed.
Dr. Goldberg.
Just a couple quick comments about the medical advisory panel and the process. I think that Governor Brown and Dr. Haganani have really outlined things really well. The COVID crisis has really, highlighted, I think, for many of us, the importance of our healthcare workforce and our healthcare infrastructure in the state, and particularly our rural hospitals, where oftentimes rural hospitals are the only healthcare for many, many miles in harsh conditions. And so the group that was advising the governor and the Oregon Health Authority really, I think, took an approach to balance a couple of really important things. I think number one, the ability for our state to continue to safely meet patients' needs. And then secondly, the other key factor was, how do we keep our vital healthcare system up and running, our rural hospitals in particular, so that they're there when we need them. And, the group included hospital chief medical officers, epidemiologists, public health experts, nurses, and individuals that came from across Oregon, rural communities, urban communities, and I think we're able to provide the appropriate kind of input to get this started, and an ability and a commitment to continue to monitor this so that we can make adjustments as we go along. You know, we're in, people have talked about, I think, a whole lot the unprecedented nature of our circumstances, and indeed that's the case. So these guidelines really are a start at opening up our hospitals, making things more available to patients, and we'll continue to monitor and provide the kind of advice so that people can have some security in knowing that this is being done in a way that'll maintain safety.
Questions?
All right,
Charles.
we're going to open things up for questions. If you're on the phone line, please press 0 to speak to the operator and get to the question queue. We're going to start out with Tess Risky from Willamette Week. Go ahead, Tess.
Charles, would you repeat the question when she's done, please? Thank you.
They won't be able to hear me though, so.
Okay.
So, go ahead, Tess.
Hey, this is Tess. Can you hear me okay?
Yes.
Okay, here. Well, I've spoken to a few healthcare workers who said that they feel this announcement has come a bit too soon. So my question is, what evidence do you have that frontline workers have adequate PPE to resume elective procedures on May 1st?
Tess, this is Governor Brown, and I'll just talk generally about our Oregon supply of PPE. Due to the tremendous generosity of our doctors' offices and veterinarian clinics across the state, we have been able to collect an amount. Oregonians working on the front lines have also done a really good job conserving PPE. The good news is that Oregon is scheduled to receive the Battelle machine that allows for safe and environmental cleaning of masks. And then Oregonians have been very creative and innovative in terms of producing masks and gowns, and really appreciate the innovation and ingenuity that Oregonians are showing. We've got companies large and small, from Nike to Renewal Workshop in Cascade Locks, that are making personal protective equipment. And then the procurement team at our Department of Administrative Services has done a phenomenal job procuring masks and gowns, and looking forward to some extremely large shipments in the next few days. But I'm happy to turn the rest of the question over to Dr. Harganani or Dr. Goldberg. Dr. Harganani, take it away.
Yes, I mean, I think pointing out, as you already did, Governor, the importance of the volunteer surplus that has been given to the state, as well as I think really the increase in receiving PPE from various sources has been critical. I would also say I would agree completely that PPE is an important part of the guardrails for opening up these procedures, and that's why some criteria have been explicitly placed in this framework for moving forward with elective procedures, specifically ensuring that adequate PPE is in place to ensure the safety of our healthcare workforce and patients.
Great. Thank you. And just a reminder again, folks on the phone, please press 0 to enter the question queue. Next, we have Lisa Bailiff from Coin. Go ahead, Lisa.
Yes, good morning. Two questions. First, what about veterinarians? Are they under this, or if not, when will they be allowed to go back to practicing? That's my first question.
Lisa, I'll go ahead and take that. I know that those of you with cats, dogs, and other animals really want to get in to see your veterinarians. I'm not sure your animals are excited as you are about getting into those offices, but that's something we'll be working on. That was a separate executive order, and we'll have a different timeline. Again, I want to say thank you to our veterinarian offices across the state that donated their personal protective equipment so that we could ensure that we had an adequate supply during the COVID-19 crisis. And we'll look forward to getting you open very, very soon. I don't know if you have anything to add on that.
Just agree, we're working on building off of the frameworks we've already created and expect to have that online in the very near future.
Your second question, Lisa.
Thanks, Governor. Governor, so far the State Health Authority is saying that there is a 5% positive test case rate in the state, and that's been pretty consistent out of those that have been tested. But a lot of people wondered when only about 40,000 out of a 4 million person population has been tested, how valid is that number? In other words, how safe are we? And also, when can somebody who wants to be tested, who doesn't have any obvious symptoms but could be positive, be able to just be tested?
Lisa, I'll let the physicians at the table answer your question about testing. Who wants to take it first? Go ahead, Dr. Harganani.
Yes, in response to the question, it is true that we've maintained percent positive amongst our testing cases at about 5%, although that has actually been declining. And I think for us, that indicates that we, with our guidance, have really been targeting the people who are most at risk of having COVID through our guidance and through the healthcare provider discretion in terms of those testing. We know that expanding testing capacity is critically important as we continue moving forward with reopening Oregon. We see further testing capacity coming on board. We just completed a survey with our labs across the state. We now looks like we have up to 3,000 tests possible per day based on, of course, ongoing challenges and focus on our supply chain. So we anticipate to be able to expand that. We have updated our guidance at OHA to expand those both with symptoms that we provide guidance on for testing, with as testing capacity moves forward, further testing for asymptomatic patients, and we continue to monitor when that capacity will be possible.
Yeah, much as you're seeing today with the loosening of restrictions on hospital elective procedures, as the state gets more and more testing capacity, there'll be changes in the ability of people to be tested. And this is something that the Oregon Health Authority is certainly working on every day and getting a lot of input from this medical advisory panel about how to sort of move forward in a way that's safe and effective for the state as well as the state gets more and more testing capacity.
And Lisa, one of the components in terms of testing as we take baby steps toward reopening is the fact that we need to have a robust public health system in place that can continue to do surveillance testing amongst our population. And it's, I would say it's a little different than our flu surveillance network because it'll have to be more rapid acting and more extensive, but essentially it's the same concept.
And just another quick reminder to folks to please press 0 to ask a question. Next up we have Camilla Ortiz. Go ahead, Camilla.
Hi there, Camilla Ortiz here with Fox 12 Oregon. I kind of have a two-part question. First, can we kind of clarify what sorts of procedures are going to be okay starting May 1st? I mean, does this mean that people can get in and start, seeing their doctor for those routine checkups? Or are we still kind of just prioritizing those more urgent procedures? And then my second question was, how is the state informing businesses and medical offices on what they need to be doing and guidelines they need to be following to stay safe so they can kind of be prepared and make sure everything is in place before May 1st?
Thanks, Camilla. I'll just say the reason why it was so important to me to begin the process of opening our hospitals, our medical clinics, and our doctors' offices around the state is I think it's critically important that Oregonians in every single corner of the state be able to access necessary medical care and dental care. But it also is critically important that we don't lose the healthcare infrastructure that we have in place. We know that our rural hospitals are essential, and the executive order that I put in place a month ago has been of extreme financial hardship to them and other hospitals across the state. That's why we thought it was really important that we move in this direction as long as we can do so safely. And with that, I'll turn it over to Dr. Harganani.
Sure. So just to respond, the procedures that we're talking about today are those that, are being lifted from the executive order that were really procedures that are elective or non-urgent and that required personal protective equipment. Those type of procedures, I mentioned some examples that can move forward now that this will be lifted on May 1st, are things that are not an emergency, but needed to be scheduled ahead, still necessary. So things I mentioned, joint procedures, biopsies, ear procedures, other things like that that require PPE but weren't in an emergency case needed. There are other types of healthcare services that have been maintained that were not restricted by the prior executive order. That includes things like essential, preventative care services like checkups that were mentioned. Our guidance are that those can be continued and have been continued, but needing to give thoughtful consideration for risk of transmission in an office setting. So encouraging people to use telehealth services where they can, maximize social distancing within an office setting. And those precautions should still continue, but those types of services can still be maintained.
Camilla, I'll only just add that if there are any silver linings as a result of the COVID-19 crisis, it's the fact that telehealth has become a very essential part of our healthcare system and an essential way for Oregonians across the state to access medical assistance. I don't think I add anything to that. Dr. Goldberg.
I would just echo what the governor said and say it, not only has it highlighted that, but it's a really convenient and cost-effective way to get health care. And hopefully it's a change that will continue with us and something we're learning from this crisis.
Thanks, Camilla. Next up, we have Nick Budnick from the Portland Tribune. Go ahead, Nick.
Hi there. Thanks for the opportunity. Two questions I wanted to ask. How exactly are you going to be monitoring this situation to see if it's being conducted in a safe way? Will there be any criteria or benchmarks that you will be looking at? And secondly, following up on tests of Lenwick's question, will there be any accountability for businesses that are not protecting healthcare workers, that do not provide the PPE that people need?
Thank you, Nick, for your question. I think from my perspective, as these medical clinics begin to open up for necessary healthcare procedures, I think it's critically important, and we will be watching to make sure that staff on the front lines have access to the appropriate level of personal protective equipment, masks, gloves, and gowns. I think the other thing that will be very important is to make sure that in communities across the state that we continue to protect a set-aside capacity in our hospitals in the event of a surge or a breakout of COVID-19 in those particular communities. So those are two of the things that I'll be watching. For technical details, I'll turn it over to Dr. Harganani.
Here, I'm going to chime in and give Dana a break for a second. One of the things, Nick, that the state's going to be carefully monitoring and monitors every day is hospital admissions, as well as the bed capacities in hospitals, which are being reported. And lastly, obviously, and most importantly, the state is monitoring the number of cases and the testing that's going on around COVID. And so as a result, there'll be an ability to see in terms of those metrics whether or not some of the steps that have been taken have had any kind of an adverse effect on what's going on in our community. So I think that there's going to be an ability to monitor the effects of this.
Thanks, Nick. Next up, we have Pat Duras from KGW. Go ahead, Pat. Pat, are you there? Is someone from KGW on the line?
Can you hear me now?
Yes.
Sorry about that. Two-part question. One, frontline workers, if they go into their office and they find they're in a dental office, for example, and believe they don't have the appropriate amount of PPE, is there anyone they can alert other than going to their boss and getting in trouble? And And I think that is my main question. Also wondering if this order covers physical therapy centers as well. Thank you.
Pat, your question, who should frontline workers contact in the event that they don't feel like there's adequate PPE? They should contact Oregon OSHA. And then your second question, I'm sorry, I forgot, and I didn't write it down.
Physical therapy.
Physical therapists.
Yes.
Right. Does this cover places where folks go for physical therapy?
Yeah, this is Dana Herganani, and the answer is yes. I mean, we kept medical offices as fairly broad. Again, the particular focus on this are procedures that had required PPE, and those may be limited in a physical therapy setting. So again, ongoing precautions around social distancing and infection control should be maintained, both in a physical therapy setting as well as other medical offices. But yes, it would apply as well.
Next, we have a question again from Camilla. Go ahead, Camilla.
Thank you. I just wanted to circle back because I had a second part in that question that I don't think got addressed. And that was, how does the state plan to inform medical offices of the proper safety guidelines so they have plenty of time to make preparations before May 1st? And what does that communication, I guess, look like?
Sure. The question was related to how we will notify healthcare workforce about safety guidelines. And actually, we've been doing that for quite a while. Our website at the Oregon Health Authority has a tremendous amount of information around infection control guidance, visitation policies, PPE usage, and it links all to the federal sites, CDC and FDA, and aligns with those types of guidance. So that information, it should be available, and we certainly will respond to any additional needs that come up.
And then I would just add, I know that the state has been participating in statewide teleconferences with healthcare providers every week. Over 500-600 people have been attending those, and as well as an ability for OHA to work through the associations and professional societies in the state that have been working with the state and are communicating to their membership as well.
And Camilla, the Oregon Medical Association and other medical providers association have had input on this order and the work we're doing, and we'll continue to work collaboratively with them.
Great, thank you.
Thanks, Camilla. Just a reminder, please press 0 to enter the question queue. If you're having trouble asking your question, please email Nikki Fisher, and she can send us your question in writing. We have one question from Jeff Manning with the Oregonian. It's a 3-part question. Jeff says, some of the largest health clinics in Oregon have laid off 80 to 90% of their staffs that have been shut down for weeks. Rural hospitals are reportedly critically short of cash. Will the return of elective surgeries be enough to save them? What is your position on hospitals' request for the $200 million bailout? And then finally, we're going on 400 healthcare workers contracting the virus. That seems like a really high number given the total number of cases. Does that raise questions in your mind about hospital precautions or the lack thereof?
Thank you, Jeff, for those questions. I hope some of my colleagues wrote them down because I didn't. I've actually been watching very closely the percentage of healthcare workers in the state that have tested positive for COVID-19. We, in the last couple of days, moved up to about 18%. That's less than what I'm seeing at the national average. Obviously, we want to keep those numbers down as low as possible, and our ability to procure and produce adequate PPE, personal protective equipment, as well as accessing a Battelle machine to clean that equipment should substantially improve those numbers over time. And I'll let other people pick up the rest of the questions.
Just let me chime in on a couple of those points, Jeff. I think that the layoffs that you mentioned actually kind of highlight the fragility of our healthcare system and the need to have it there functioning. And I think one of the ways to be certain we don't have any further layoffs is lifting of these restrictions. But I think you're right. that it's got to be balanced with the safety of our healthcare workforce. And I think that it's concerning, clearly, to all of us. I've got family members that are frontline healthcare workers, and the degree to which they're putting themselves in danger is really, really concerning. And so we've got to be vigilant about our ability to continue with personal protective equipment, and I think testing is going to be key. And the more and more testing we can do, we'll continue to help assure that healthcare workers are protected. But yeah, it's really concerning, and I'm just going to stop there.
The only other thing I would add is I know the hospitals have asked for a $200 million hospital stabilization fund. We're working on a different package. The details will be released soon. We're frankly waiting for the guidance from the federal government on the Coronavirus Relief Act resources before we unveil Oregon's hospital stabilization fund.
Great. Our next question is from Lisa Baird. Go ahead, Lisa.
Yeah, it's Lisa Bailey from Coin. Just a quick follow-up to perhaps Dr. Harganani. Going back to the 5% positive case rate, again, with just 40,000 out of the 4 million and so many people supposedly walking around that may have it but have no symptoms, that's essentially testing, I guess, about 1% of the entire population in the state. There are a lot of people who are very scared and very concerned that if they go out, even if they go out to a doctor's appointment now, that they could be exposed to this. I mean, doesn't there need to be a much better sampling of the population before these changes are made?
Thank you for the question, Lisa. We would certainly agree that further testing capacity is important, and we continue to do everything we can to secure that and see really significant positive movement forward. There's 2 new locations in Oregon who just took on testing in the last week, and we know there will be more to come soon. I think an ongoing, as we already mentioned, the role of testing in ongoing surveillance and monitoring for where our impact is with COVID down the road, and managing cases and case contact tracing and testing is also going to be critical. But I think it's also important to know that even though there are some individuals who have no symptoms with COVID, that those are also unlikely, or certainly less likely to cause transmission of the virus. And so our guidance historically has been really focused on those who are most at risk for COVID, as well as most at risk for transmitting COVID. And we continually increase and expand our guidance and defer to the recommendations of healthcare providers to test where appropriate.
Lisa, the only thing I would add is that this has been a challenge for the entire United States of America. I don't know how much you read the national news, but clearly the federal government needs to continue to step up its efforts to provide testing capacity to the states. And obviously, we're working as quickly as we can to make sure that we have the right types of testing in the right locations around the state.
Great. Thanks, Lisa. Just a reminder again to please press 0 or email Nikki if you have a question. That's Nikki Fisher at Oregon.gov. The next question is from Kelly Azar with K2. Kelly says, dental offices and surgical offices donated their PPE early on when non-urgent procedures were canceled. That being said, how are they prepared to reopen? How will you ensure that they have the supplies they need to reopen? What specifically are the guidelines to have a clinic open? And then Kelly goes on to say, people who are high risk working in this field are concerned about reopening too soon. What do you say to that? Some are wondering if they will be picked off unemployment if they choose not to go back to work because of their health.
So I'm obviously concerned and want to make sure that we are protecting our frontline healthcare workers. The reason why we shut down medical clinics, hospitals, and dental offices from doing non-urgent care was because not only did the state, but frankly the country lacked adequate personal protective equipment. It is my sense, based on the information and the data that I see, that supply chain has been restored, as I mentioned earlier, through the creative efforts of Oregonians to produce it, to make it, including our adults in custody at the Department of Corrections. We've also been able to procure it from companies around the world, and then we received donations from generous nonprofits. We are pushing that personal protective equipment out to the counties for distribution, but I'm confident that the supply chain is in much better shape, that if dental offices, doctors' offices need personal protective equipment, that they'll be able to purchase it. Do you want to add anything to that? Okay.
Great. The next question is from Brad Schmidt with Oregonian. Brad has 3 questions. He asks, given the fact that many coronavirus carriers may be asymptomatic, can you tell us what this will look like in healthcare situations? Will every staff member be wearing some form of mask at all times? And will patients also be required to wear masks when they're in a facility? Brad also asks, maybe we'll just go with that one, and then Brad has 2 more questions.
Okay. Dr. Hargagani.
Sure. So already we have guidance for the general population to consider wearing a mask when out in public, and in particular when social distancing challenges are in front of them. I'm going to anticipate that we'll maintain the same as more people enter offices or healthcare settings. Of course, individually, hospitals and other facilities have already created their own guidelines for required masking, and those will continue to be directed by their own infection control policies. And we also, as I mentioned earlier, have very clear guidance about appropriate use of PPE, when it should be used by healthcare providers, how it should be used depending on the type of procedure, whether it's aerosolizing or not. And those will be as important as ever and need to be continued. And that's, again, why adequate supplies of PPE were a critical part of our criteria for these elective procedures to move forward.
Great. And then Brad's next questions are, what specific benchmarks will you be monitoring to ensure that the ice isn't breaking? We're currently at 124 hospitalizations, 37 ICUs, 24 ventilators. Is there a numeric threshold you're looking for, 20%, 50%, or 100% increase? And then Brad also asks, contact tracing is vitally important going forward. OHA has said it believes 600 tracers need to be hired. How did the state arrive at that number, and how confident are you that the state can ensure contact tracing is done effectively to ensure containment going forward? And Brad also thanks everyone for their time.
Thanks, Brad. I'll just talk briefly about contact tracing. It's very, very clear that we need a much more robust public health strategy around contact tracing, around testing, and around isolating and quarantine. I've asked the Oregon Health Authority to develop that strategy, and we'll be seeing the draft of that plan in the next couple of days. But the information that I have in terms of the data, we're using information that we receive from the CDC, from epidemiologists, from our local research universities, all going into coming up with a number. The medical advisory panel has been crucial in helping us develop these guidelines, and I anticipate they will be crucial in helping us develop the guidelines in the future.
And the guidelines specifically call for there being, at a minimum, a 20% excess capacity in our healthcare system to be able to respond to any increases. Having said that, I think that both the medical advisory group as well as the health authority would agree that if cases and hospitalizations start to increase, we're not going to wait for it to approach 20%. There's a need to continue to monitor on a daily basis and to adjust. And I think that there's been a commitment on the state side to do exactly that.
Great. Next we have a live question from Andrew Selsky with the Associated Press. Go ahead, Andrew.
Hello, can you hear me?
Yes.
Okay, great. Governor, you mentioned earlier on that Oregon is expecting a Battelle machine to clean masks. Just wondering where that's coming from and when that's expectable. And Also, you said that Oregon is expecting an extremely large shipment of masks and gowns. Who's providing that, and any details on that? And then just one last question is, when do you think Oregon will reach an adequate level of testing? Is there any hope that could be reached in the near future? Thank you for taking my questions.
Thank you, Andrew. And I'm going to have to get back to you in terms of the nitty-gritty details in terms of procurement. I know we're receiving a number of shipments, particularly of N95s, N95 masks in the next week. And I'll have my team get back to you in terms of where those are coming from and what the companies are. I do not know where the Battelle cleaning system is coming from, but I'm really grateful that we are receiving one. I think this builds on Oregon ethic of sustainability and will enable us to reuse masks after cleaning multiple times. And I think it's a really key component to ensuring a sustainability of supply of masks in Oregon. Did you have one more question, Andrew?
Yes, it was about when do you expect or hope that Oregon will reach adequate testing, not just capability, but actually, carrying out testing to be able to tamp down any outbreaks if they occur, pockets of outbreaks, and to do the contact tracing.
So I want to say thank you to the Oregon Health Authority for working really, really hard to come up with our testing strategies and plan. Still not ready for, I will just say the I's are being dotted and T's are being crossed at this point. In terms of adequate supply, I think it's really about having the right types of tests in the right locations. And I think there are multiple components to that, including obviously being able to test vulnerable populations. Our Latinx community has been especially hard hit by this virus. I know that there have been some recent cases in our Native American community, making sure that we can adequately test our vulnerable populations. That's got to be a priority. Number two, making sure that we can test those that are symptomatic and those that have come in contact with those that are symptomatic. Obviously, our ability to do surveillance. In terms of numbers, I know last week we were talking about moving from, we've been doing roughly 8,000 tests per week. I think that will need to at least double and probably a little bit more than that. I don't know if either of the doctors can help me out with more specifics in terms of numbers, but.
I can't help out on numbers. I can just say that testing is critical, and it's pretty clear. We don't have enough. We need more. We need to have robust contact tracing, and these are vital pieces to allow us to continue to keep people safe and to start to approach some degree of normalcy.
And Andrew, I've had multiple conversations with folks at the federal level about the need to increase Oregon's testing capacity. For example, spoke personally with Dr. Deborah Birx a week ago Tuesday, have spoken with Congressman Walden and Senator Wyden about the need, have spoken with other governors. I know this is a challenge for most states across the country. The reason why I say most is that the hotspot states, I think, have adequate testing supplies. But I know that Governor Como is still struggling about having adequate swabs and adequate reagents.
Thanks, Andrew. We've got time for just a couple more questions. We're going to go next to, it says Pat with Willamette Week, but I'm not sure if that name is correct. Is there Pat on the line?
Tess from Willamette.
Okay, thanks.
Yeah. Sorry if this question's already been answered, but Governor Newsom in California today made a similar announcement, except for his order does not include cosmetic procedures. I'm wondering, will Oregon allow cosmetic procedures starting May 1st?
Go ahead, Dr. Harganani.
Yes, I will just tell you that what we have started this opening by asking our facilities to really start slowly and to intentionally focus on those procedures that have the most urgency and to look at the indications for those. So we are not telling providers exactly what they can or cannot do, but we know that those that are most urgent and necessary are going to be the first on the list as these procedures open up.
I think, Tess, this is a great example of taking a step on the frozen pond to make sure that it's actually solid. And I think we're testing to see if it's solid. And if it's not, we're going to take a step backward. And if it is solid, we'll be able to take another step forward.
Okay, thank you.
Thanks, Tess.
Thanks, Tess. We've got one more question. This one comes from Rob Davis with the Oregonian. He says the Supreme Court, he has a question on the Supreme Court ruling on donation limits, wants to give the governor a chance to weigh in, particularly as it relates to whether the governor believes that the ruling now means that the stringent limits of Measure 47 are in effect.
Thank you for the question. As someone who's been working to bring reasonable campaign finance limits to Oregon for over 20 years, I was certainly pleased to see the ruling of the Oregon Supreme Court this morning. I think this moves to more of a case-by-case determination in terms of whether limits are reasonable. It is my plan at this point in time, once we're beginning the reopening work, that I will continue our efforts to amend Oregon's Constitution, Article 2, Section 8, to clarify that we do have the ability, either through the legislature or by the people, to enact reasonable campaign finance limits in Oregon.